complete relax ho jao. Start rubbing your hands on each other. First slow, then slightly vigorously till you feel heat, and now put them to your face. Good. How do you feel? Warm and nice. Whenever we rub our hands together and massage our face, we feel good. Why is that so? Why does that happen? That happens because 70% of the veins or 70% of the nerves which are going from brain are going only to your hands and your face. See, this is the cross section of the brain, and in the brain our body parts are represented. This is the face. These are the hands. Okay? This is again the face, and these are the hands. Okay, so almost 70% of the veins or 70% of the nerves from the brain are going to the hands and the face. So when you are rubbing your hands together, okay, done. Okay. Whenever you are rubbing your hands and putting them to massage your face, your brain feels that 70% of the body is massaged, and that's why we feel good. And in the same way, many of us, we know how our brain looks. Our brain looks something like this, a fresh brain, yeah? But how does the brain see your body? Our brain sees our body like this. And this is not my observation, this is given in the book by Dr. Ramachandran, who is a neurologist. And this is the picture given there. What it shows is our brain sees our body as very big face, large lips and large hands, and very small torso. Okay, what this means is again that our brain gives extraordinary importance to our hands and our face. Okay, so now we are going to see how we are going to use it in the wellness factor in face reading. We have already taken the face reading part 1, where we have seen what is the well-being or how can we see well-being from the face. Now we are going to see the second part, where we will see various diseases and various problems that we can diagnose from the face. Those of you who want detailed information, they can see this book, Ancient Wisdom for Modern Problems, which is in the library over here. And what we have seen last time is basically the shape of face, shapes of face, then hair, the forehead, the eyebrows, and settings. So we had seen how to observe the face, how to find out what shape it is, and what shape will give us what kind of health problems or what kind of things to expect from that face. Today what we will be seeing is how to examine the face in the mirror. How to examine the face in the mirror. And today we will be using more of the whiteboard than anything else. The face can be divided into 3 areas. The first is the top area. This is called as mental or thoughts. This is called as emotional. And this is called as physical. These 3 parts are not separate, but they are connected. So any problem that has got origin in thoughts will be seen in this area. Anything that has got origin in emotions will be seen in this area. And something that is purely physical will be seen in this area. Okay. At the same time, it can happen that the problem started as a thought and then become physical. In that case, we'll see it in these two areas. They will be connected. Or a problem started as emotion and then it became physical. Then again these two areas will be connected. All these three areas are connected. They are not separate. But for our convenience of studying, we are making them look separate. Yeah. Now on this, the body is superimposed on the face in this way. In this way, this is called as the head, then this is the neck, these are the hands, these are the lungs, and these are the legs. This is the way the body will be represented on the head. The diagram also is given here. This is the way the diagram will be seen. Head, lungs, arms, the lower body parts, legs, and this is the lower part of the legs. This is the way the whole body is superimposed on the face. And we take the same body for understanding the illnesses or problems from the face. So for example, if you see here vertical lines like this, then the person is thinking too much. Person is too serious. And the problems that the person will face will have something to do with this seriousness. Because of seriousness, other things will follow. It could be depression, it could be a nervous tension or something of that sort, but these lines have to be there. On the other side, if these lines, after some time you see that they are becoming fainter, that means this person is not under much tension. Okay? You start seeing something which is unusual in this area. This is the area which has something to do with responsibility and expression. For example, you are getting a mole here or darkness here. This person is likely to suffer from frozen shoulder, problem with the shoulder, or pain in the shoulder area. Pain in the shoulder area. Okay? If at the same time you start seeing pain here, the eyes are red, bloodshot, etc., etc., then in that case the emotion is that of frustration. That I am able to see something, I want to do something, I am not able to do it. It is anger, frustration, hopelessness. These are the emotions will be seen when you see bloodshot eyes, or even if you see the bags under the eyes. That has something to do with liver function. But on the mental level, what is that liver function? Is I am having some kind of hatred. I am feeling some kind of hopelessness. I am feeling some kind of dejection, which is emotional in nature. That's why this happens. The person who is repeatedly having sinus problems, you will see that there is some indication in this area. The nose is too small or too thin, or this area has dark patches or something of that sort will start happening here. And just think of it, no person gets a naturally small nose. The nose is adequate enough for the body. So it is a comparative statement. At the same time, you start seeing some people, you will see that they have got a dark patch here on the nose or this side. There are dark patches. What do these dark patches show? Is dark patches show some problem with the digestive system. Now we are coming to the border of emotion and physical. These lips, these are showing the intestine. If you see the lips of people or your own, you can always see the difference between a dry lip and a wettish lip, a full lip and a dryish kind of lip which is become thin, which has become thin. This is the function of the intestines. So now you can connect it that there is a dark spot here, so things in the stomach are not working well. The lips look dry, which clearly means his intestines are not working well. Why are the intestines not working well? Is the dryness. So that means this person is suffering from chronic constipation because of lack of fluids in the body. This is the kind of conclusion that can be drawn, and this is something that you can ask him. Okay? This area will show the genitals, and this area will show the lower part of the body. If you have some blemishes here, the person is likely to have problems with this area, the calf muscles. Now, if the person has dry lips, he has got problems in the calf muscle, again you have to check up whether it is because of lack of fluids. If it is because of lack of fluids, then all that he needs to do is drink a lot of fluid, and this area and this area, both of them will clear up. Now you will see that there are three types of chins. One chin is like this, pointed. One chin is like this, and one chin is like this. Okay? This chin is physical, this chin is emotional, and this chin is mental. If this person is having a health problem, because this is a mental person, he is not taking any physical exercise at all. That will be the main cause of this person having problems in his body.
This shape, no?
This shape, yeah. Very conical, almost absent kind of chin. That person is not likely to be physical. That person is mental. So he only thinks. This person is emotional. So he will have more to do with these areas. Now we are connecting back and forth we are connecting. Yeah? This person will have more emotional issues, and this person is very physical anyway. So if this person comes to you, you will have to give him physical exercise, whereas if this person comes to you, giving him physical exercise will not help at all, because this person is anyway highly physically active, and in this case the person is not physically active at all. This person is physically active only when he is emotionally agitated. Okay? So this person, what is the advice that you should be giving is, for this person doesn't matter what, you got to go out and exercise. In case of this person, exercise with your head calm. And for this person, take rest. Because this person is physical. And this is the way we can analyze the whole face and connect it together with the rest of the body. Okay, these are the simple things. This is now you need to start checking out whether it happens this way. For example, again and again, all the factors that I said, they are again reflected on the ears separately. These ears again represent the whole body. In case of ears, the head is here and the legs are here. So the people who have got bigger upper ears are highly physically active. Okay, and bigger lower ears are mentally active. Again, the same thing corresponds. So this is something general about the face. Now we'll go to the specific diseases which are shown by the face examination. Okay, any questions so far? So far so clear. Okay.
But for sinus, is there any emotional reason?
Yes, sinus is actually completely emotional. Sinus is
What kind of?
taking breath.
Oh yeah.
something to do with breathing. And whenever the person is having a negative emotion, he will not want to take the breath. So he is stopping the breath in a theoretical manner. He is stopping the breath. That's why the sinus trouble starts. And then after some time it becomes habit. So whenever this person is challenged for something, or he feels that there is an examination coming up, anxiety attack, that anxiety attack will be accompanied by a sinus infection, because the body's immunity will go down in that time, and whatever is around you will affect at that point of time. So sinus attack will come. In fact, you will see that most of us have a favorite problem.
Means maybe one may be physical, but if person is more anxious,
Yes.
then the sinus may come.
True. And see, as I said, most of us have got a favorite problem, is because that is the way we have been brought up, or that is the way we have accustomed our body to understand that this is the problem. Like for example, you can see, go to the gym and you can see that some people have big arms, in the sense arms which are having lots of fat. Middle-aged people, lots of fat, especially ladies. Some people have this muscle very fat, these areas. Some people have buttocks, big buttocks. Some people have big thighs. So actually what is happening, why should this happen differently in different cases, is because the body says that okay, I am getting more food than what I want, I am getting more energy than what I want, I need a go down in the body to keep this energy. So that energy is fat. Now the body starts finding which is the area which is least disturbed. So if you are working in a bank or something and you are sitting in a chair, these back muscles of the body are least disturbed. So these are the people who will store their fat in the back muscles, back of the leg or the buttock muscles. Those some people, when they who don't move like this at all, in case of those people, the fat will be stored in these muscles. Those people who do not move their arms much, which happens with today's many of the housewives, because they don't have much physical work to do with their hands. In that case, the fat will be stored in the arms. So that is the way the body will find its own go down to keep that fat. And when you start exercising that part, the body will automatically know that now onwards we cannot store it here, we have to go somewhere else. Okay?
But in some cases, you show three-part different arms.
Yeah.
So all are fat having.
Yeah, because one go down gets full, you go to another go down. Another go down gets full, you go to another go down. That's the way the body works.
Somewhere you have to store.
Yes. In fact, I can also tell you stories of somebody who became so fat that when he used to walk, his calves, these muscles, they used to rub against each other and he used to get injured. Yes. If you read Indian history, this example is given there. Yes. And this was in case of Chandrasekhar Azad. Chandrasekhar Azad was a great freedom fighter, and at some point of time he had to go underground. This fellow was used to doing something like 2000 baitak every day. So all of his legs were fully fit. But in the underground, because you are away from the police, you have to hide from the police, you cannot even get out of the room. There was absolutely no exercise. And as a result of which, this person became fat because the food intake remains the same. And there is no exercise. And in case of that person, it becomes much thicker. The calves became so thick that they would rub against each other. Of course, after he came out of that underground, then very quickly he could reduce because of other, because anyway he was physical person. But the general answer is, if the body finds one go down is full, it will go to another go down. So, and that way even in the face, you will see a lot of fat is stored. People who lose fat, their faces also become thinner. Okay. So that we have done. Now we'll go to the specific diseases. Now we are going to the specific diseases, and the specific diseases are here like this. This is the bladder. This is the intestine which I already taken. These are the lungs. See, lungs are here and the pump is here. Your cheekbones are the pumps for the lungs. Yeah. So these are the represented by lungs. Then there is pancreas here, liver here, and kidneys just below the liver.
That is why they say, na, if it is a puffy,
Yeah.
you have that.
Kidney problem, yes. Kidney problem occurs after the liver says over.
Okay.
I can't handle it anymore. that kind of thing.
Headache aap le lo.
Yes. This is gallbladder. This is again liver. Those people who have headache, especially on this side, they say it is because of heat. It is not because of heat, it is because of the bile. Because of heat, bile is produced. Because bile is produced and it comes from this side, the heat comes out from this side, that's why you start getting throbbing pain of the head when the liver is underactive. Okay, and this is the point where the thought center is there. Thoughts. So if you have headache, for example, now we'll see if you have headache over here, headache is here, then it is because of your thoughts or negative thoughts. Headache is on these two sides, then it is because of the liver problem or body heat or bile problem. The headache is here, it is because of seriousness, taking things too seriously. Okay, if the headache is only on one side, this side or this side, yes, then it is because of not taking the responsibility or thinking that responsibility is too much. That is the way even the headache can be distinguished. And if it is a throbbing headache which is all over the place, it is because of blood pressure. Okay? Overall to overall. This is the way we can analyze the whole face and see where the problem is. What you can do is when you wake up in the morning, your systems are starting up. Every day morning, if you start watching your face in the mirror, you will be able to start seeing the changes that are happening in the face from day 1 to day 2, day 2 to day 3 and day 3 to day 4.
And even if you see sometime your own face,
Yeah.
you see in the morning and you see after 2 hours,
Yes.
it slightly changes.
Yes, yes, yes.
Because of what?
This is because of the process that has happened during the day. During the day, your health might improve or it might go down. So morning face and evening face, that is the way you will be able to see. Actually, in our case, we are not doing any physical activity, so there is no reason to feel tired in the evening. But we do feel tired. That tiredness is all mental. So your face should not feel tired. Your face should look the same. Whereas what you can see is, if you really want to watch, in the morning the lips will be full and wet. And during the day, by 11 o'clock or so, the lips will start going dry. You are not still feeling thirsty, but your body is saying there is lack of water. Okay. Now there is also, you can see marks here. This is because of calcium deficiency. Calcium is not there in the body, or calcium is not being utilized in the body. Water is less.
Some kind of crack type.
Crack will develop. Yes, yes. The elasticity of the skin goes down. So wherever the skin requires elasticity, that is the place. This is the only place in the.
And cracks on this.
That is because of yes, intestinal problems and lack of water. Because water has got almost 20 functions that it fulfills in the body. And all of us here, all of us are generally highly dehydrated. Highly dehydrated. Okay, because we are staying in AC and so on, In fact, I'll give you how much do you think we urinate in a day? How much quantity?
At least 2 liters.
Okay, fine. 1 to 1.5. Okay. And how much do we sweat in a day? That can be measured. That is measured in steam bath and so on. You are right on the first answer. 1 to 1.5 liters of urination and between 3 to 7 liters of sweating.
3 to 7 liters?
Yes.
That much?
Yes.
Means even if it is not summer,
Even if it is not summer.
3 to 7?
Yes.
Does it change with like Bombay is a very humid place, but does
Yeah.
it change from
It will change. It will change. That's why 7 liters. Like place like Mumbai, it will be 7 liters.
From where this all water comes?
Yeah, no, 7 liters will be a person who is doing a huge amount of physical work in the open area, in sun.
Even if you take 3,
Yeah, they drink a lot of water. They have to drink. Otherwise, at the end of the day, will be, that's why they need to go in for alcoholic drinks and all. Because by the end of the day, when the water is less, your dehydration has already set in. And your calves will start having these problems. I don't know what it is called. There is some specific word. The cramps. You start getting cramps. Cramps is because of lack of water. And see, the skin is there on the whole body. And the whole body sweats. So the problem is, we feel that because we are urinating every 3 hours, we are drinking enough water. No. More water is going out from the sweating than going out from urination.
But it is possible for who is most of the time using AC or staying in AC.
Yeah.
So how it is 3 liters sweating?
Sweating. The sweating is happening. Sweating has, that is another problem. The sweating is already happening all the time. Even if you are in the AC. Yes.
we will not come to know, but it is.
Will not come to know. But it will still be there. Just think of it that one drop comes out of every hole of the sweat hole. How big are you? You are a square which is 6 feet by 3 feet. 24 square feet हो गया on the front. 24 square feet on the back. So 48 square feet का area आपका है. You got a area of 48 square feet. 48 square feet पे इतना सा पानी गिरा है. तो it will be at least 2 liters. In 5 or 10 minutes. You are getting it? Just giving the idea. Whereas your kidneys or your liver, kidneys are this much. Liver is this much. Okay, liver to chodo. Kidneys are this much and bladder is this much. So how much water can it hold? But because it is concentrated at one place, we feel that we urinate more and we sweat less. It is exactly the opposite. So that's why we don't even know. Yes, that's why we don't even know when we are dehydrated. Because we feel that if I drink water, so many people have come to me saying, if I drink more water, I will urinate more. No, it doesn't happen at all. Doesn't happen at all that way. You ask the players on the ground, they drink up to 5 or 6 liters of water, but still they don't urinate. They don't go to the loo. Because they are sweating. They are sweating a lot. And the body will let that water go only when it feels that it is okay to let the water go. So this is one of the lips are the most important part, lips and the eyes of the face. You look at these two areas and you see the whole person. What kind of problem that person could be having. Okay. Or for that matter, a person who is pursing his lips. That is, he is trying to hold his mouth, make his mouth small. Indication of chronic constipation. Simple. Pursing of the lips. His lips are this big, but he is trying to hold it like this. Yes. He is holding the mouth tight. Another, when he is holding the mouth tight, he is holding his intestines tight.
It is a natural habit.
Natural habit. Yes, because of which the constipation is created. Okay. So this is the way we can see various diseases or various problems, not diseases really, because disease becomes a disease when the problem goes out of hand. till then we start seeing a lot of indications of these beforehand. And this is the way you can check your face, look at the mirror and check your face for good health all the time. And we should be checking it for good health, not for bad health. That is a warning sign. You should be seeing it for good health. मेरे में क्या अच्छा है? What is good in me? That is what I should be seeing in the face, rather than the other way around. So if you are
Color also some
yes,
significance.
yes, color simple. Color is red, pink, yellow, and white. Red is heavy blood pressure, temper, frustration, anger. Pink is normal. Yellow, liver problem, or yellow also shows lazy disposition. Lazy disposition, it is called as lazy intestines, lazy body. He doesn't want to do anything physical, and this is anemic. So actually yellow goes to generally white, because yellow is doesn't want to do and white cannot do. He doesn't want to lift a thing. This fellow cannot lift a thing.
Next stage from yellow.
Next stage is white. Yes. There is no face as called as black.
Sometimes I
Huh.
have seen some old people, they have black spots like that.
Yeah, we talked about those black spots, lungs.
Lungs problem.
Something is to do with lungs. He is not exercising his lungs. He is not doing exercise.
But this develops afterward.
After some time.
After some time.
After some time. Yes, you have seen black face. Yeah, where?
Color of skin of some people is black.
The Africans and all.
Patch and all this.
That is a natural color is black. But if you see that skin in this way, you will see that it is pink.
Sometimes.
Yeah, you can even see a picture here. Yeah, here it is. You cannot see this color as black. That is a skin color.
Skin.
You can see, when you see this person, you have to compare it with other black people to see whether this, because this person also will be pale, also will be white, this person also will be yellow, this person also will be, of course you will not be able to see it this much. In that case, for example, this person will always be yellow.
Yeah, because
Chinese.
Yeah.
So you have to compare Chinese with Chinese, black with black, white with white. You cannot compare them across. That is what makes face reading very difficult. Black spot is this here. If the black spots are here, then there is some lung problem. It is above, there is liver problem. If it is black spot is here, bladder problem. Black spot on the nose, then it is something to do with the lungs, that is breathing, something to do with breathing problem. If it is here, black spot above the eyes in this area, then it is that person is getting more responsibility than what he can bear with. Okay, and if the black spots are here, you will see some people having patches on the head. Yeah, they are thinking too much.
Number of people I have seen.
Yes.
One side black.
Yes. Also, all the time they are dead. What they are doing is they think that they are thinking. They are actually not thinking. They are only going in round in circles. They are saying, Aisa, this is the what will happen, then that will happen, then I don't know what will happen, then this, then this, then this. This is a kind of concentric kind of situation. And that energy is going from this area. So the skin will start showing the result of it, which will be black. So before you take out this examination, you should already know what is the base color of the face. Then only you can take up this examination. Till then, no. You can't just see a person in the railway and you can say, "Arey, liver mein problem." That is not the way you can do.
Yeah, you have to
Okay.
compare
If the
with
person is suffering from something, then only the color will be changed.
Yeah, the color change will start even before the suffering starts. But if the color has changed, then the suffering is there. Because see, as I said before, the disease is much later. First the process starts. The process of going towards that, for example, if I don't drink water today nothing may happen. after 2 days, 5 days, 7 days, 8 days, I might start feeling slightly tired. Then something might happen. That kind of thing. So the problem might occur maybe 3 months from now. But problem has started now. That way. Okay. So this is, I'll summarize what we have seen today. What we have seen today is how the face is divided into mental, emotional and physical parts. How the body is superimposed on the face. How you can examine your own face to understand various your body parts, internal as well as external. You can also understand the nature of the person, whether it is physical, mental or emotional, from looking at his jawline or chin, and based on that you can make a judgment. You can also see the correspondence between various body parts and the parts of the face, and this is something that you can utilize to make judgment about health from looking at your face. Okay, so this is face reading part 2. There will be part 3 and part 4 where we will go into much more detail in terms of health. If you got any problems, you can always refer to this book because it is dealing with all 4 parts at the same time in a nutshell. So some information is given here, some information is given here, and this book is to be used in conjunction with the lectures. And now if you got any other problems or any other questions you want to ask,